Everybody, today we'll quickly discuss about Ludwig's angina. What is Ludwig's angina? It is the infection of submandibular space. Let's talk about the gross anatomy of submandibular space. Submandibular space, on one side of it lies the floor of the mouth, while on the other side lies the superficial layer of the deep cervical fascia. That is, see, this is your tongue. This is the hard palate. This is mandible and this is hyoid. This makes the floor of the mouth, and this is the superficial layer of the deep cervical fascia. So, from mandible to hyoid bone runs a muscle, mylohyoid muscle, which divides this entire mandibular space into two compartments. I mean this entire submandibular space into two compartments. Above mylohyoid muscle is the sublingual space, while below mylohyoid muscle is the submaxillary space. Infection of this submandibular space is called Ludwig's angina. So what are the causes of Ludwig's angina? Infections from the root of molar, premolar tooth can spread to the submandibular space and cause this Ludwig's angina. And then infection from oral cavity like cell adenitis, that is submandibular cell adenitis, fractures of the mandible, and injuries of oral mucosa can cause infection in the submandibular region. As far as the bacteriology is concerned, both aerobes and anaerobes are common. Now let's talk about the clinical features of Ludwig's angina. So when there is infection, what comes first in your mind is swelling plus tenderness. So this swelling can give woody hard feel in the oral cavity. Now when there is presence of swelling and pain in the mouth, will it make your eating easy or difficult? It will make it difficult. So swallowing would be difficult. Other than that, the tongue can be pushed upward and backward. And when this happens, there will be obstruction in the airway, making it difficult for a person to breathe. Tongue can be pushed backward against the posterior pharyngeal wall, causing a laryngeal edema, which can be life-threatening and should be treated on priority basis. Now when a patient comes to you with Ludwig's angina, he or she may somewhat look like this, with swelling in the angle of the mandible. So how do we treat this patient? To treat this patient, what is the treatment of choice for any infection? It is antibiotics. So we give systemic antibiotics in Ludwig's angina. If abscess is formed, treatment is always incision and drainage. If the abscess is formed in the sublingual space, we go for intraoral approach. While if abscess is formed in the submaxillary space, then we opt for external approach by giving transverse incision at the angle of the mandible. In case airway is endangered, then opt for tracheostomy. If we talk about complications of Ludwig's angina, then infections from submandibular space can spread to parapharyngeal and retropharyngeal spaces and hence to mediastinum. And because of laryngeal edema, there can be airway obstruction. Septicemia can be caused because of Ludwig's angina, and then aspiration pneumonia is another complication of Ludwig's angina. That will be all for today, and do not forget to read this topic. It's important from your examination point of view, and I'll see you in my next video.